Morning, everyone, and thank you for joining us. I'm Kristen Rubino, the chairwoman of this year's Go Red for Women campaign. On behalf of the American Heart Association, we are excited to launch Syracuse STEM Has Heart. As chair of this year's campaign, I know that Go Red for Women is dedicated to removing the barriers women face to experiencing good health and well-being. The price of being a woman is high, and when it comes to cardiovascular disease, 1 in 3 women will pay that price with their lives. The work of Go Red for Women is more important now than ever. We all know this pandemic has been a stressful time, but it's been even harder on women. More women are out of work than men, and women are taking the lead, balancing virtual learning for the kids while working. Together, we can make an impact on women's health. We can protect our mothers, sisters, daughters, and our friends. As part of that commitment, the American Heart Association is officially launching a new STEM Has Heart program today. For more details on what this program is and why it's needed, please welcome STEM Has Heart Chairwoman, Amanda Tirzian.
Thank you, Kristen. The reality is our health is about more than just our bodies. We know that the lack of sufficient education is associated with a higher prevalence of cardiovascular risk factors, adverse events, and cardiovascular deaths. Removing barriers to good health and well-being includes closing gender gaps in research and in STEM fields. Black, brown, and multiracial women, including those who identify as female, continue to be grossly underrepresented in cardiovascular research and in STEM careers. It wasn't until 1993 that women were required to be included in clinical trials. Even now, only 38% of cardiovascular research participants are women, and women of color are significantly less represented. Women make up nearly 50% of the workforce, but less than 25% of STEM careers. In fact, only about 3 out of every 100 female STEM degree holders will go on to actually work in a STEM field. Research shows women experiencing cardiac events potentially have better outcomes when treated by a female physician in the ER. We need more women creating solutions for women. Today, we are officially launching the STEM Has Heart campaign. We want to help ensure more women are at the forefront of developing science, technology, engineering, and math solutions. STEM Has Heart will feature regular virtual events, including a research lab tour featuring American Heart Association funded researchers and a STEM speed networking event. In the fall, pending local, state, and federal guidelines, we are planning to host an in-person summit featuring STEM leaders and local students. Throughout the program, a regular newsletter will keep participants up to date on local STEM opportunities, scholarships, events, and news. These activities will help provide the next generation of girls and young women with the opportunity, and it will encourage them to explore the potential they possess to make a real impact on the world around them. We look forward to working with Central New York STEM leaders as we empower the next generation of brilliant female leaders and innovators by providing pathways for future careers in STEM. STEM is our future for women, and it is at the heart of what we all want for our community and the world, so women may take charge of their health, become leading innovators on industry trends, make memorable connections, glean invaluable insight into their health, and fight the #1 killer of women, heart disease. Thank you.
Thank you, Amanda. STEM Has Heart also goes beyond Syracuse Go Red for Women. It is equally being enacted by and with the leadership and support from the Syracuse Heart Challenge campaign. In fact, embodying this comprehensive approach between the 2 AHA campaigns in Syracuse, our 2022 Syracuse Heart Challenge will be chaired by none other than Carrie Sweet Zavalia, General Counsel for National Grid. The incredible program would not be possible without the support of local sponsors. So how appropriate is it that the first ever Syracuse STEM Has Heart program is sponsored by National Grid, a longtime corporate sponsor of both the Syracuse Heart Challenge and Syracuse Go Red for Women. That's why Alberto Bianchetti, Central New York Regional Director of Customer and Community Engagement for National Grid, has a special message for us today.
Thank you, Kristen. National Grid aligns with Go Red for Women to bring messages of empowerment to our community, including students. We at National Grid believe that a diverse STEM strategy is the key to a 21st century workforce. We need to empower girls and young women, especially Black, brown, and multiracial women, to improve the heart and brain health of all citizens through careers in science, technology, engineering, and math. STEM education creates critical thinkers, increases science literacy, and will improve the lives of women and all people while developing tomorrow's leaders today.
Thank you, Alberto. Now it's my pleasure to share an example of the power of STEM careers. Currently, the American Heart Association is funding more than $750,000 in local research. One of those local researchers who was funded by the American Heart Association is our next speaker, Plansky Hong, who's a graduate of Henniger High School. While studying at Syracuse University, her research received funding from the American Heart Association. After earning her PhD, she stayed at SU as a postdoctoral fellow. Now she's sharing her experience to help others. Please join me in welcoming Plansky Hong.
Thank you, Kristen, for that great introduction. So a little bit about my work is that I work on the development of an in vitro model of a growing heart. And we use this developing heart model to determine medications when taken by pregnant women, if they may or may not be harmful to the heart health of unborn children. In a little more detail, what I do in the lab is I grow what are called organoids, which are miniature models of an organ that's grown in a dish, and they're generated from stem cells. And by making heart organoids, I study how they grow, develop, and respond to things such as external stress and medications. And the cool part about the organoids is that they can be made using cells from actual patients, giving us the opportunity to personalize the diagnosis and treatment. As Amanda mentioned earlier, women and racial minorities have remained disproportionately low, not just in research, but in clinical research as well. And that's why I'm happy to be able to work in this field and be part of ensuring outcomes that are beneficial to everyone. And knowing this only reinforces the need to increase demographic representation to ensure healthcare is accessible and equitable to all people. What I like about my work is that it focuses and targets specifically women's health. And I think it's important to focus scientific research on these populations, especially since pregnant women are classified as medically vulnerable. I'm the first person in my family to pursue a PhD, and it's been extremely rewarding for me, especially because I have been able to mentor the next generation of scientists, most of them who are young women from minority groups. So one aspect of my career that I really value and wanted to carry on with is the mentorship and education aspect to the next generation of scientists. Thank you for the opportunity to be with you today and share a little bit of what I do.
Thank you, Plansky. You are doing amazing work, and it's great to know that you mentor other women. Through the STEM Has Heart program, we hope to inspire more women like Plansky. And STEM Has Heart is not just focused on young women in our community. Young men who are Black or brown are also underrepresented in the STEM fields, depriving our community of inspirational role models in technology, medicine, and science. Join us as we launch Syracuse STEM Has Heart and bring opportunities to local students. Together, we will ensure more diversity in the realm of STEM fields and build a brighter, healthier tomorrow. If anyone would like to get involved with the STEM Has Heart program, please reach out to Trina Tardone or Kristen Thompson-Henry at the American Heart Association. And before we finish up this morning, we will open the field for any questions. Please feel free to put your questions in the chat box. Okay, if anyone has further questions, please contact Christy Smorrell, and a live recording of this event will be shared with everyone who has participated. Thank you so much and have a wonderful day, everyone.